we can listen and learn from you. So Bridget, take it away.
All right, thank you. Appreciate the opportunity to share what I've learned over the years. As you can see, I have been doing this for 24 years, and I learn something new every survey. I mean, so that's the thing we were talking before, that there's not a manual on how to do this. You learn from others, and each time we do something, we learn something from the surveys. So, and how to prepare and do it a little bit better the next time. So, next slide, please. All right, so I'm going to date myself here. I don't know if any of you remember a show called Fantasy Island, and they used to say the plane, you know, and so you get that announcement because we don't know when they're coming anymore, and CMS has instructed the deemed accrediting organizations to not let facilities know that they're coming, and when your state shows up as well, they don't know. So you just get a message, somebody's here, somebody from administration will call. It's usually typically where they ask to go is to see administration, talk to the administrator in charge first. And so that's when you start rolling, you grab your stuff and you get everything and you head to administration and find out what's going on. Next slide, please. So today we're going to talk about briefly about the different types of surveys, some of the things that we can do to prepare to make it a little bit easier. Rounding and being out there all the time is a really good way to prepare, to see what's going on, how important it is to communicate with your team so that they know what's happening, and some other tips that I've found along the way to be successful. Many of you probably already know, but if you don't, the CMS certification survey. So if we participate in the Medicare program, CMS wants you surveyed. In our state, the state does Medicare surveys for CMS. If you do not have deemed status or an accrediting organization such as Joint Commission or DNV or the compliance team to take care of those surveys, they'll do recertification surveys, EMTALA for any violations for the Emergency Medical Treatment and Labor Act. Our state comes out and does complaint surveys on behalf of CMS. They'll do licensing surveys in order to maintain our hospital license. And then, of course, you can always choose to do specialty certifications with any of your accrediting organizations. Again, most of these are unannounced. Most of the time, you don't know when they're coming. And, so it's important that we try to do what we can to prepare. Next slide, please. So, a big part of that is making rounds, and we're going to talk about our rounding team and what we can do to do that, because you don't know what's going on out there if you don't get out there. We think we know what's going on out there, but a lot of times when we get out there, we find out it's not really the way we think the process is going, or maybe our staff's made workarounds on how to do a process. So it's really great to get out there to see what's happening. I always tell my managers, I try to meet with new managers so that they know what the expectations are. And I tell them, it's your house. You're in charge of what's happening on your unit, with help from others, with help from dietary, with help from ancillary departments, with help from plant operations. You're there all the time. So it's your job to see what's going on and report it, get help. You don't have to fix everything, but you need to be aware of what's happening in your house. I have a utilization. I've utilized a readiness checklist that I have given to Helen and Kim, and they're going to share that with you. But it's just a quick checklist to these things that we're looking at, making sure nobody's blocking a fire extinguisher, our medications are locked. There's lots of things on that list. Please utilize it, change it if you want. It's not copyrighted or anything. It's just something that I've developed to help give managers, for us to make rounds with, to give them survey dates real quick. Hey, use it anytime, but it's great to say, pull out and make a quick round, these things that you forget when you're in a hurry and they're here. Because if sometimes the surveyors will go out immediately, sometimes they'll start asking for documentation. Sometimes if they don't get that documentation immediately, they'll start rounding. And it's good. It's a good checklist just to use daily or weekly, frequently, to remind staff of the things that we need to do to be compliant. Scheduling prep sessions. So some of the accrediting organizations, such as Joint Commission, and the compliance team, they give you information. They tell you how the survey is going to run. They will say, we're going to have a session on quality or medication management. Use that survey activity guide. It will tell you what some of the topics will be. And I find staff like, or our leaders like to prepare. They want to see what are the topics that we might talk about. It gives everybody a chance to brainstorm. What do we want to talk about? What do we want to brag about? What do we not want to talk about unless they ask? So use those prep sessions if you can schedule them. I suggest around 6 months prior to when you think you're going to be surveyed. Most of them come every 3 years. Critical access hospitals come every 4 to 5 years. So, when you're pretty much due for a survey. Check websites frequently, newsletters that your accrediting organization sends, that Medicare sends, CMS has out. I've also created a list of some of the websites I check frequently to stay up to date on changes, and I've shared that, so that'll be shared with you as well. CMS has a website where they put out policies, notifications to state and regions, and so that's usually where the first time we'll see something, either in the Federal Register or on that website, to see what's coming down before they actually change the manual. I find CMS takes a long time to actually change our conditions of participation. And so, but the standard's effective usually 30 days after those notices come out. So stay up to date as much as you can with what's changing. Utilize any accreditation prep tools. CMS has in all of our manuals, the conditions of participation, they talk about. The first part of that manual is what they're going to do during a survey. Utilize that. Look at those things. Any of your accreditation organizations, they have tools that you can use, checklists for required documents they're going to ask for. Look at those things. Try to start preparing for those and pulling those documents. Really important, periodically assess. I try to at least once a year meet with my managers and do a standards assessment with the conditions of participation, our state licensing standards, your accreditation standards. And part of that is bring in your last survey findings. While you're doing that, review that, go over and find out what did they cite last time, because they're going to be looking for that. They're going to look to see, did you correct that information? And so make sure that that manager or the leadership of the hospital, they're aware of what those things are. Did we fix it? Is it still fixed? Look at those things. Go through the standards and ask those questions. Are we compliant? How? Ask that manager, show me. Don't just say, yeah, a lot of times people will say, yes, we're compliant, but talk about what makes you compliant and how you can prove it to a surveyor, because that's what you're going to have to do. Keep all of your minutes. We all have quality meeting minutes and medical staff meeting minutes. Try to keep those as up to date as possible, because they'll usually ask for the past 12 months of those meeting minutes. And then this is something my old boss coined the term bird letters. Make leadership aware of anything that comes from a government agency usually has the bird on it. We have the state seal of Louisiana has a pelican in the middle of it. CMS letters have their CMS bird on it. And so just make sure that people are aware that we usually have to do something with those. They're either telling us about a new regulation or they're asking for information. Usually those are very important. So be sure that leadership knows that when those come, they should be shared and addressed as soon as possible. Next slide, please. So as I said before, surveys are unannounced, but we can do a lot of things to get ourselves ready. We can organize. I used to make a prep box on wheels that we can throw pens, notepads, sticky notes, folders, things that you're going to need to have. Copies. Make sure you have a copy of your hospital license, your CLIA certificates, and make sure they're up to date. Sometimes they expire, or they all do expire. Make sure you have the most current ones. A lot of times our surveyors will ask to see those. Anything that the document request log sheet, start pulling those important documents, patient rights policies, restraint policies, PEC or suicidal precaution policies. Those are all hot topics. Medication administration. You can kind of look at those, make sure those policies are up to date. Have a current copy of your organizational chart, list of key personnel and with their titles, because they usually want to know that as well. Beforehand, sit down and figure out in your organization who's going to help you get the information that you need, such as your daily census, your OR schedule. logs, your employee list, what person in those relative departments will be your contact and who's their backup, so that you're not trying to figure out during a survey how to, who's going to get me this information. The other thing is to remember when during a survey to help staff. They're going to talk to staff, they're going to watch staff. So just remind them to be honest, it's okay to, answer the question correctly. If you're not sure, tell the staff to say, I'm sorry, I'm a little nervous. Let me refer to my policy. Tell them to answer, but not give too much information. Don't offer information they didn't ask for, but answer the question to the best of your knowledge. And tell them it's okay to say, hey, can I see what document you're looking at? Because sometimes they're referencing a policy, or they're looking at a chart and they're asking about their documentation. And it's okay for the staff to know, I can ask to, look at what they're referencing so that they can answer appropriately. We already talked about key documents. We've always established a command center, so a place that we're very close to the surveyors, know where you're going to place the surveyors as well. Is there a conference room or an educational room that you can put them in? Decide where that's going to be, have a place near that so that you can get that information, filter that. You don't want too many people going in and out. We always had a command center where people could check in, could provide the documents so that somebody could kind of look over them before we just handed them to the surveyor, or maybe they're in a meeting. You don't want somebody just busting in on them. So it's really good to have an area where you have a phone, computer capabilities, copier capabilities, so that you can provide information to the surveyors. Start thinking too about who's going to be with the surveyors, who's going to walk around with them, take them where they need to go. They should always have a pen and paper, kind of write some things down. So who are those escorts going to be? Have a person in the command center that you trust that will help organize things, get, your policies, get your documents, call other departments, provide lunch for the surveyors or coffee or something like that. So have someone and a backup for who that would be to help you out, because you're going to be in lots of different directions. You're trying to figure out what they need, trying to get them. It's not too bad when there's one surveyor, but when there's several, it can be overwhelming to make sure everybody's getting what they need. Decide ahead of time who's going to be your expert with the medical record. That's really important, but somebody's going to have to navigate that chart with them. A lot of us have electronic medical records now, so somebody who is very knowledgeable about where things are documented should be that person to go through the record with the surveyor. I found recently over the last few surveys to use a messaging app such as GroupMe for easy communication. We all start texting, we're going to this unit, we're going here, and sometimes it's hard to look up people's contact information. So if you have a group set up, already established for that, or your leaders are in it, you can just start saying, hey, we're going here, or they're asking about advanced directives, so that information is getting out to your leaders and they're just kind of prepared. It just lets everybody know what's going on. Obviously, we don't want to put patient information in there, but you can talk about topics and where you're going, or I need a policy. They're asking about this policy. Can somebody pull it? Those kinds of things. I always pre-set up contacts in my email so that if I have a leadership group or an infection prevention group or something that I need to get out an email quickly to about, well, we're going to have a meeting or we need you to come talk about something. Very easy to, and just to say surveyors are here, to let staff know, we're here, they're going to be around, please be helpful. And then also it's important to keep our employee files and competencies up to date. They're going to ask for that. Usually it's for whoever they've looked at the chart of the patient and whoever took care of that. Sometimes it could be other key important personnel as well. Next slide. So we find it very helpful to have a rounding team. You can call it tracer team, rounding team, whatever you want to call it, but to go around and to do what a surveyor would do, to help prepare staff, to give them information, and also that you can see things on a timely basis and correct things for the safety of your patients, not just to prepare for survey, but so that things aren't going wrong all the time. If you see something's not right, you can fix it immediately. Sometimes we get so involved, we just keep doing what we're doing. And if we don't look, then we don't get a chance to see what's really out there. You can have various team members for this. Regulatory persons, usually very important, infection control, patient safety or risk management. I always like to have my plant operations or facility management people because they see things, they can get those corrected right away. A nurse or your managers, I invite them as well. So your team can vary. Sometimes two people will go out. So we used to set it and try to go out at one time to a same unit. So it's important to kind of have a rounding schedule so that you can get to all of the departments in your hospital. And so if you want to go out once a week or every 2 weeks, once a month, whatever fits your needs. And then sometimes our team had conflicts and they couldn't, but they would know, all of our managers knew that, hey, we're, rounding, you'll see us, we'll talk to your staff, we'll give you some information. And sometimes they needed to go at different times, but we tried to do that to help prepare staff as well to get comfortable. Have some rounding tools. So each person's looking for something different. Obviously, infection prevention is looking for infection prevention stuff. Our plant operations are looking for certain things. A lot of times as regulatory, I would just talk to the staff and look at that. So, and be sure when you're done to create a report and send that to managers. And it's not always one manager. It might be head of that department, but other departments that are involved for things you find, you want to share that with them so they can correct any issues as well. And we always do kudos as well. If somebody participated, because a lot of times staff run, they don't like to talk to a surveyor. We like to congratulate staff for participating. Next slide, please. So when we do get the staff involved, we do things that a surveyor might ask them, such as, where do you find this policy? What is your emergency codes? And remind them it's okay to use your badge. They're on the back of your badge. How do you participate in handoffs between departments? Or how do you communicate with a patient who doesn't speak the primary language? How do you get an interpreter? Talk to them about isolation procedures. But it's really important. We've established when we do our rounding, this is not a punitive process. We want staff to learn. So if they're not doing it right, I want to show them, well, here, they didn't know where the policy was. Here's where you can find that policy. Or if we've implemented a new process, remind them of what that new process is. We want them to trust us. We don't want them to be afraid of us, because as a rounding team, we want them to learn. We want them to ask questions. We don't want them to feel like they're going to get in trouble, because the whole point is to share our knowledge with them and to make sure that they don't know something, that they do know the right thing when we're done. Give them an opportunity to ask questions. And if you don't know the answer, because sometimes it's unit specific and you may not, find out and then get back to them. So let them ask us about the process, help give them any information. I like to explain surveyor roles to them, explain that they're going to ask you about what you're doing, about your policies. They may watch you do the things that you do and observe, and then always thank them and praise them for participating and being a part of the process. Some of the things that we look for in the rounds, and it's on the checklist that I'm sharing with you: infection control issues. Construction areas are very important. We've all had it happen where we need to paint a certain area, they take down the signs, somebody forgets to put up the sign. So, you've had that EMTALA sign up, but, they painted the wall, or the sign got damaged, or somebody forgot to put it up. So it's really important to look back at any construction areas after they've been done to make sure everything that was there in place before is still in place after. Other things you're going to look for, evacuation routes are clear, that we're not blocking our fire extinguishers or gas panels. Looking at our logs, is the crash cart log up to date, our eye wash station? These, again, we'll share with managers. So sometimes a new manager doesn't realize that they're responsible for making sure all these things are done, and so they get forgotten. We're going to look for medication security. Sharps are locked. Patient information is kept private, that our wiles are not open for everybody in the hallway to see. Next slide, please. Also, big thing, expiration dates. Open drawers. A surveyor, I find they have radar. They will open the drawer that nobody's used in about 5 years, and somebody shoves something in the back of it, and whatever it is now expired. So do those kinds of things on rounds. Dig. Make sure PPE is available. Watch staff going in and out of rooms. Are they adhering to hand hygiene? Or a big one right now, or for all over is multi-dose vial dating. Is, when they pop open that vial, did they date it for 28 days for the expiration? Our glucometer controls, those also have expiration dates and have to be, they're not what's on the bottle. It's 90 days after opening. So did somebody label that? Do we know when that really expired, how long it's been open? Infection control issues such as separation of clean and dirty items. Sometimes staff forget and they put the housekeeping cart in a room that is a clean storage room. They didn't do it on purpose. They didn't know, they just needed a place to put it. So those are the kinds of things we want to make sure that we've separated clean and dirty items. Any broken equipment is labeled not in use so that it's, doesn't get used on a patient when it shouldn't be. Staff are using 2 patient identifiers. So again, observe processes, watch someone go give medications or do a blood draw or a glucose check. And then another thing surveyors like to do is pull a piece of medical equipment, ask you when the last time it's been checked. It should be labeled, but then they'll say, okay, when was it checked before then? So are we following our policies and procedures for that as well? Other tips, sending notification emails, letting people know what's going on. Always follow your own policies. They should be built off of our standards or just the way you want to do something. That's what they're going to hold you to. Did you follow your own policy? A big thing too is following instructions for use. So are we cleaning equipment? Are we checking it all according to what the manufacturer says? So if it has to be done every 6 months, then has it been done every 6 months? Try to stay up to date on standards changes. Things change all the time. Look at the Federal Register that's on the website list that I gave you as well. That's where a lot of new things or proposed things will come out. And then once they're finalized, you can check them. Remind your staff to be respectful, provide information timely to surveyors. They get antsy if they think you're hiding something or you can't find something. And then have end of day meetings with leadership. To keep them up to date. What happened today? Let's talk about it. Is there anything we can, try to fix for the next day or remind staff to make them a little bit more comfortable? The other thing is just important. We used to have something that says, we call an all clear at the end of the day. Don't let all of your managers leave if because a lot of times at the end of the day, before they leave, the surveyor is going to provide you with a list of documents that they need. Get those that evening, try to get the help for that. So that you're not trying to call people that have left and trying to figure out what's, where that policy is or something that you need. Just a little tip on follow-ups, begin working on action plans immediately. They do a closing, what's happening before they leave. Don't wait for the final report because you're on a very short timeline. Usually it's 10 days to turn around and tell them what you're gonna do. So start working on that immediately. When you do those action plans, don't corner yourself into the impossible. Do what's realistic to meet the guideline, set realistic timelines, and then make sure you get all the players involved to create that solution. You don't want to say someone's going to do something that they can't really do if you're, sometimes we're not always involved in the process. If it's a clinical process, I don't want to tell nursing how they have to do something. I can make suggestions, but I don't want to tell them how they're going to have to do it. They have to be able to provide a solution that they are capable of implementing. So I'm sorry, I know it's a lot of information.